Blood pressure medications. Blood pressure medications, also known as antihypertensives, are drugs used to manage hypertension, high blood pressure. There are several classes of antihypertensives, each working through different mechanisms to lower blood pressure. Some common classes include 1. Diuretics. Help the body eliminate excess salt and water through urine, reducing blood volume and lowering blood pressure. Examples include hydrochlorothiazide, furosemide, and spironolactone. 2. Beta blockers. Reduce the heart rate and the heart's output of blood, which lowers blood pressure. Examples include metoprolol, atenolol, and propranolol. 3. ACE inhibitors, angiotensin-converting enzyme inhibitors. Relax blood vessels by blocking the formation of a natural chemical that narrows blood vessels. Examples include enalapril, lisinopril, and ramipril. 4. Angiotensin II receptor blockers, ARBs. Block the action of a natural chemical that narrows blood vessels. Examples include losartan, valsartan, and irbesartan. 5. Calcium channel blockers. Relax blood vessels and decrease the heart rate by preventing calcium from entering cells of the heart and blood vessel walls. Examples include amlodipine, diltiazem, and verapamil. 6. Alpha blockers. Reduce nerve impulses that tighten blood vessels, allowing blood to flow more freely. Examples include doxazosin, prazosin, and terazosin. 7. Centrally acting agents. Decrease the ability of the brain to send signals to the nervous system to increase blood pressure. Examples include clonidine and methyldopa. 8. Vasodilators. Directly relax the muscles in the walls of blood vessels, particularly the arterioles, leading to dilation of blood vessels and lower blood pressure. Examples include hydralazine and minoxidil. Each type of medication works differently, and doctors may prescribe one or a combination of these medications to achieve the best blood pressure control for a patient. What do blood pressure medications treat? Blood pressure medications primarily treat hypertension, high blood pressure, which is a chronic medical condition where the blood pressure in the arteries is elevated. Consistently high blood pressure can lead to various serious health problems. Here are some conditions that blood pressure medications help manage and prevent. 1. Primary hypertension, essential hypertension. High blood pressure with no identifiable cause, which constitutes the majority of hypertension cases. 2. Secondary hypertension. High blood pressure caused by another medical condition, such as kidney disease, endocrine disorders, or certain medications. 3. Heart disease. High blood pressure can lead to coronary artery disease, heart failure, and other forms of heart disease. Controlling blood pressure reduces the risk of these conditions. 4. Stroke. High blood pressure is a major risk factor for both ischemic strokes, caused by blood clots, and hemorrhagic strokes, caused by bleeding in the brain. Blood pressure medications help lower this risk. 5. Kidney disease. High blood pressure can damage the kidneys over time, leading to chronic kidney disease and potentially kidney failure. Managing blood pressure is crucial for protecting kidney function. 6. Aneurysms. Elevated blood pressure can cause blood vessels to weaken and form aneurysms, which are bulging, weakened areas in the walls of arteries. Proper blood pressure control can help prevent aneurysms from forming or rupturing. 7. Vision loss. Hypertension can cause damage to the blood vessels in the eyes, leading to retinopathy and potential vision loss. Blood pressure medications help protect eye health. 8. Peripheral artery disease. High blood pressure can lead to atherosclerosis, hardening and narrowing of the arteries in the limbs, causing pain and mobility issues. Managing blood pressure reduces this risk. 9. Metabolic syndrome. This cluster of conditions, including high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels, increases the risk of heart disease, stroke, and diabetes. Blood pressure medications can help manage one aspect of this syndrome. By lowering and controlling blood pressure, These medications help prevent complications and improve the overall quality of life for individuals with hypertension. How common are the usage of antihypertensives? The use of antihypertensive medications is quite common, reflecting the high prevalence of hypertension globally. Here are some key points about the usage of these medications. 1. Prevalence of hypertension. Hypertension affects approximately 1.13 billion people worldwide, making it one of the most common chronic medical conditions. This prevalence increases with age, and it is more common in certain populations and regions. 2. Prescription rates. In many countries, antihypertensives are among the most commonly prescribed medications. For example, in the United States, about half of adults with hypertension are prescribed antihypertensive medications. 3. Multiple medications. Many individuals with hypertension require more than one medication to achieve adequate blood pressure control. It is not uncommon for patients to be on a combination of 2 or more antihypertensive drugs. 4. Long-term use. Hypertension is a chronic condition, so most patients will need to take antihypertensive medications for the long term, often for the rest of their lives, to maintain blood pressure control. 5. Preventive health measure. Given the association of hypertension with serious health risks like heart disease, stroke, and kidney disease, the widespread use of antihypertensives is an important public health measure. Proper management of hypertension through medication can significantly reduce morbidity and mortality. 6. Global variations. The use of antihypertensive medications can vary significantly between different countries and regions due to factors such as healthcare access, economic conditions, public health policies, and cultural attitudes towards medication and healthcare. In summary, the use of antihypertensive medications is very common due to the high prevalence of hypertension and the significant health benefits of controlling blood pressure.